Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Today, we're in part 2 of bringing on a new associate. So we went over last time metrics, numbers, and indicators of when it's time to hire an associate. But today, we're going to speak about managing expectations and ways to bring on a new dentist into the team more successfully. And that first starts out by managing your expectations. Now, I see a lot of dentists, they do this, and they bring on a new dentist, and they'll say, I don't want to work on children anymore. I don't want to work on this little old lady who has a 3mm opening. She's too hard to work on, and I'm tired of doing interproximal fillings. I'm done with those. I just want to do the crowns. That's all I want to do. And unfortunately, this is setting up the new dentist for failure. I've also seen dental offices where they accepted Medicaid, and the dentist that owns the practice said, I'm not going to see those Medicaid patients anymore. I just want the associate to see those. And this again sets the associate, the new dentist, up for failure. So we need to make sure that we set them up right, and we set them up as well as the team to succeed. So that's what we're jumping into today. First off, recognize what type of practice do you want to build. Do you want to focus on cosmetics? Do you want to build a practice around giving IV sedation? Find out what type of practice you want, and then recognize what do you lack. If you brought on a new dentist and maybe you don't like to do root canals, maybe finding a dentist who likes to do root canals would be really wonderful for you, or a dentist who wants to do IV sedation. Think about things that you don't currently have that are available to offer in your practice, but you would like to offer. What type of dentist could you bring on that would complement your practice and build the practice that you want? So recognize that. So define what type of practice you want. Then from there, know how many hours and what days you're willing to work. Are you willing to work evenings, Fridays, or Saturdays? Recognize what you're willing to do and what you're not willing to do. So you want to recognize your days and the times you want to work, but also your non-negotiables. Are you willing to give up a Saturday afternoon? Or are you willing to help an assistant take down or set up a room? What are your non-negotiables? Because once you know those non-negotiables, you're able to build a practice that you want with a new associate. And then what qualities would your ideal associate have in terms of skill set and personality, but also work ethic? What type of qualities do you want from them? Once you have that foundation, though, you can start reverse engineering the type of an associate that you want that will complement not only your practice, but also your goals. All right, so once the associate's set up, we need to set them up even more so for success. Once you've hired the right person, the real work begins. Too often, dentists expect the new associate to hit the ground running. I'll be honest, this is another recipe for failure. It takes time for a new dentist to walk into a practice and understand their computer system, their software, their protocols, how the team works, how they like to communicate. It takes time for them to adjust. So give them 1, 2, 3 months to adjust to that. What we recommend is that when you bring in a new dentist, you give them a base pay for the first 2 months. And that can mean $300, $400, $500 a day. Depends on what the cost is in your area as far as the cost of living, but give them a base pay. And then from there, let them know after your second month, you will get paid a portion of what you produce. And you define that, whether it's 25% to 35% is the norm. It just depends again on where you live, but let them know you're training them to get used to diagnosing, communicating, working with your team, and becoming more confident in their ability. So give them a little bit of a baseline, but then you want to encourage them to diagnose. And that gives them enough time to start adjusting to your team. So I really like doing that, but you choose what works best for you, but you want to give them a little bit of time to adjust to your practice. I like to think about teaching someone to learn how to walk before you teach them how to run. And that's what happens with this. You want to teach your new dentist how to walk first in your practice,
before you teach them how to run. And then get your team buy-in and communicate with your team. This is critical for the new dentist for the success. Your team's acceptance of the new associate is key. If the team isn't on board, patients will sense this disconnect, and it's harder for the associate to gain trust. So start by giving your team a voice. Explain why you're bringing on an associate, ask for their input and how to support this transition, and encourage your team to give the new dentist honest but respectful feedback. This is critical for success. I've seen with the new dentist come in and they do treatment on a patient, and the patient will say, well, they diagnose. The patient says, well, how long will this take? And the new dentist says, well, I'm not as fast as Dr. Jones, but I think I'll be done in 45 minutes. Now, that's not the right answer to give. Patients don't want to spend more time in the dental chair. So the new dentist is going to need help and coaching with their wording. And they could say something like, I'm going to make sure you're comfortable, that we take care of this tooth properly. This is going to take me 45 minutes. Notice we focused on care, not on being faster than another dentist, because that's where we need to focus. And then another thing that we saw happen is the dentist was working on a patient and the assistant asked, do you want me to pack the cord or do you want to pack the cord? And the dentist replied, this new dentist, bless his heart, really sweet guy. And he said, no, I think you're faster and better at it than I am. I'll let you pack the cord. And then when the patient gets up front, they say, I don't want to see that new dentist again. He's not confident in his ability. I don't feel comfortable having him work on me. I want to see someone else. So you need to really teach them how to communicate in a positive way, because he could have said 100 of other things than saying that he thought the assistant was better at it. And that's something that we're working on with new dentists, is building their confidence and getting them comfortable diagnosing, treating, and watching their wording with their team. And then you need to have daily check-ins or debriefs, if you will, where you want to check in with this new dentist, this new associate, and ask them what went well today. And then from there, you can ask what could have been handled better. Learn from them what they're learning, because this is a learning opportunity. Don't treat it as a failure, because it's not. It's an opportunity to learn. And as they start out, they're going to have a lot of learning opportunities. And then find out what are their gaps in communication or treatment planning. This is one thing I think is critical for dentists, is that when they first come out of school is how to pivot. So you can show them intraoral pictures, x-rays, full mouth probes, and ask them, well, what would you do for this tooth? And the dentist will say, oh, definitely a crown on this tooth or an implant here. And then from there, you need to add context to it. I need to say, okay, this woman is 83 years old. She was just diagnosed with cancer, and she doesn't want to lose her teeth. What would you recommend now? And watch the dentist pivot. Watch them learn how to diagnose with context to the treatment plan, because too often we give them a really basic treatment plan and they're able to say, yes, I would do a filling here, I do a crown here, an implant there. But if we give them a story, and that's what happens behind every patient, there's a story, and let them know what's going on in the patient's life, sometimes it changes the diagnosis because of what's going on in the patient's life. So another example is, this man just lost his job. He's 47. He loses his insurance in 30 days. What is the best treatments we can do to use up his insurance, but help him to move forward so that way he's healthy as possible? We have 30 days. So you have to give them a little context so that way the dentist can shift quickly and confidently in their treatment plan. And then set goals and vision. Remember the big picture. What type of dentist you wanted to be? What kind of practice did you want to build? What are your goals as far as hours you're going to work or not work? What are your non-negotiables? And how your practice wants to be. Always refer back to what you desired to build when you opened up those doors, and then build upon that. By referring back to your non-negotiables, referring back to what you want for your practice, you're going to succeed much in a happier way, with a better practice that you dreamed of, and the way you wanted to live. If you need help finding a new associate, we're here to help you, but there are a couple of resources you can use. I encourage you to go to dental schools, go to corporate offices where there are dentists, then also look at networking opportunities, speak to lab people who you order supplies through. These can be a huge asset to bringing in a new dentist. There's also DDS Match, Indeed, and other dental specific job boards you can go to that will make it possible for you to bring on the right associate. Take your time interview, learn from them, because this is a big decision and I want you to succeed. Our goal is your success.